design Good morning.
Good morning.
Let's try that again. Good morning.
Good morning.
Much better. Welcome to our combined pinning of health sciences and nursing. My name is Dr. Dorothy Chase, and I'm the Dean of Health Sciences and Nursing. I'd like to thank all of those who have come to celebrate the accomplishments of our graduating students in the health sciences and nursing programs. As you can see, we have a packed house. We're also live streaming this program, and there's additional seats available both in the lobby of this building and in the next building over in L101. If anybody is over in those live streamed areas and wants to come over to this building, there are several seats open and up in our upper deck. There appears to be lots of open seats up in the upper balcony. So if anybody is over in the live streamed area and wants to come over here, I just want to make that announcement to those people. As for some housekeeping, please be aware of where the exits are in the building. There's several exits out on the side and on the upper area in the back and on the sides. If you can please make sure you silence your cell phones, that would be wonderful, just to make sure that we can be celebratory here today. There will be light refreshments following the ceremony out in the lawn area just outside the auditorium. Every student in the first few rows has accomplished something monumental to be proud of. All healthcare programs are both a challenge and an honor to be accepted to and successfully complete. The pinning ceremony symbolizes a student's hard work and dedication to both their coursework and their clinical work. Pinning marks a transition from student to practitioner. Each of you has completed your coursework and are competent to provide healthcare to our society. As we pin each of you, this is considered your official welcome into your profession, completion of your educational requirements, and your transition into your profession. Here on stage with me, each of our faculty began at some point right where you are, each of you in your current student, where you are today. I would like the faculty on stage to take a moment to stand and be recognized. Thank you. Many of our faculty began in a certificate or an associate's degree program and now hold higher degrees. I am one of those stories as well. I started as a CNA and worked as a phlebotomist, then became a nurse, then worked through my education to where I am today. I hope that many of you choose to do some of those steps as well, and that maybe one of these days you'll also stand either as a faculty member or in my shoes. Whatever your path, we are so glad that you chose Bristol to be part of your journey. If everyone could take a moment to stand for the national anthem. Maybe. Okay. Huh? It's supposed to play. It's supposed to play.
Yes.
Sean, the national anthem. Thank you, Sean. Well, a little bit abbreviated because the volume wasn't up, but that's okay because you didn't really want to hear me sing anyway. I'd like to introduce President Laura Douglas to both welcome and greet all of you this morning and to present our keynote address. President Douglas.
Thank you, Dr. Chase, and good morning, and welcome to the 2023 Health Sciences and Nursing Pinning Ceremony. Can you believe that we have made it to this day? That you are graduating with a credential that very few people attain? When I consider what your class will be known for, it might be the class that saw the most of these go up your noses. It's been a lot of them. It's been a lot of them, right? Well, I know we won't miss the days of nose swabs and COVID tests, but they did keep us very safe through a very challenging time. When the pandemic began and working in healthcare became very challenging, many professionals said, "This is not what I bargained for." They left the field because they no longer could dedicate their life to the service of humanity in the healthcare setting. But you are the ones who know exactly what you have trained for. You are so dedicated to the service of humanity and to the health and well-being of our communities. You are noble, and I hope that when I'm sick or need care, that you are my healthcare professionals. Faculty and staff, give yourselves a hand. Faculty and staff, you have been outstanding and deserve so much credit for safely shepherding our students through such difficult times. You have found multiple ways to teach our students what they need to know. You've provided empathy and understanding and kept our students motivated to succeed. Thank you for being the exceptional educators that you are. Without you, our students would not be here today. Let's give them a round of applause. Tomorrow is commencement, and I look forward to handing you your diplomas and celebrating with you and your loved ones. You are not just clinical lab scientists, dental hygienists, EKG technicians, medical assistants, therapy assistants, or phlebotomists. You will be graduates. You will be earning a credential that is recognized throughout the world. It's your stamp of arrival. You've accomplished what kings and queens, professional athletes, and even Hollywood celebrities have been unable to do. Earn a credential that demonstrates that you have attained a very special body of knowledge. With your college degree, you are unstoppable. Go forth and do great things, save lives, promote good health, and foster kindness and well-being in our community. I know that you are going to make Bristol Community College very proud. Thank you. And now I would like to ask Dr. Chase to return to the podium to present our recognition of the graduates.
Good morning again. Each one of you started this journey toward a career in healthcare during a historically difficult time in the world for healthcare, and yet each of you chose to enter this profession to help others. When you began, the people in your program, your classmates, and the faculty and staff were strangers, and today these people sitting to your left and right are now your colleagues and friends. Your success here shows a strength in each of you that deserves a round of applause. In all medical professions, we take a pledge to uphold ethical standards. The Hippocratic Oath is an oath most are familiar with, the oath of ethics historically taken by physicians. It is taken from Greek medical texts and includes physicians taking an oath to uphold and swear by a number of healing gods. This oath is one of the earliest expressions of medical ethics in the Western world, establishing the principles of medical and healthcare ethics that all of our professions hold. These types of oaths have morphed over time. Here, we will pledge taking a professional promise in the form of an ethics pledge. I would like to ask all of our health sciences and nursing students soon graduating to please stand and turn to the back page of the program as we recite the professional promise ethics pledge together. Are you all ready? Okay. In full knowledge of the obligations I am undertaking, I promise to care for those I am responsible for with all the skills and understanding I possess, without regard to race, creed, color, politics, or social status, sparing no effort to conserve life, to alleviate suffering, and to promote health. I will respect at all times the dignity and religious beliefs of the patients under my care, holding in confidence all personal information entrusted to me, and refraining from any action that might endanger life or health. I will keep my professional knowledge and skill at the highest level and give loyal support and cooperation to all members of the healthcare team. I will do my utmost to honor the code of ethics and uphold the integrity of my profession. Thank you. You may all sit down. We are now going to begin pinning all of our graduates. Students are going to be recognized by program in alphabetical order. We are going to ask the students, there's a little X on the stage. We're going to ask that you stand on the X as you come across the stage so that we can take your photo. Your photos are going to be uploaded so that you can share them and you can take those, download them, and do something if you'd like with your photo. So we'd like to make sure you step on the X. When your area is called, we'd like you to stand up and move all the way to the end of the aisle. So when your aisle is called, if aisle A is called, groups A sitting, stand up and move all the way to the end in case there's a different group in your aisle as well. So I'm going to start with clinical lab science, but row A needs to, everybody stand up and move all the way to the end. So we're going to start with clinical lab science. I'd like Dr. Kelly Hiller to come to this podium.
Thank you.
You're welcome.
Just like growing up with a maiden name that started with B, I get to go first. So welcome. Many of you are probably wondering, what is clinical lab science? Not everybody knows what clinical laboratory science is. So our clinical laboratory science program will produce clinical laboratory technicians, or you've heard of medical technologists or medical laboratory science. Once they graduate, our students will become eligible for an accreditation, which is a requirement for employment. 11 states currently require the licensing of clinical laboratory technicians. They may serve as phlebotomists as well, but their key functions are to perform scientific tests, procedures, examining and analyzing body fluid or other blood, tissue samples, microorganisms, bacteria, abnormal cells, and biochemical irregularities. 70 to 80% of medical diagnoses are made based off of data that's provided by medical laboratory technologists or clinical laboratory technicians. Today, you're here supporting and our soon-to-be clinical laboratory science majors. Thank you for volunteering your arms, blood, and putting up with gross dinner table conversations, potentially. If you live in my house, that's what happens. Phlebotomists are also, and I'm going to speak to phlebotomy as well, even though we're pinning you in alphabetical order, phlebotomists are often at the forefront of clinical laboratory science. They are at the front lines. They are collecting not just blood samples, but other samples. Many of you are familiar with this, with COVID testing as well. Phlebotomists are also able to collect those as well. Without the phlebotomists doing their accurate collection of samples, what we do as clinical laboratory technologists wouldn't be accurate. So, clinical laboratory scientists often have what's called a pledge to the profession, and this will also apply for phlebotomists as well. We, in addition to the ethics pledge, we have this pledge where we are going to place our own needs and our desires and our welfare above our patients. We are going to ensure that each patient receives care that is safe, effective, efficient, timely, equitable, and patient-centered. We maintain dignity and respect for the profession. We promote the advancement of the profession. We ensure collegial relationships within the clinical laboratory science and our patient care providers. We improve access to laboratory services. We promote equitable distribution of healthcare resources, and we comply with all the laws and regulations protecting our patients from others' incompetent or illegal practice. And we change conditions when necessary to advance the best interests of our patients. Our graduates here at Bristol will not only fulfill this pledge, but will uphold it to the highest standard to care for all of us and our loved ones. So I'd like to, as your name is called, Professor Cinco is behind me, sorry. He will call your names, and I will give you your pin.
Giovanna De Acevedo. Rachel DeMello. Erica Ferreira. Sadan Keo. Anna Paiva. Derek Pereira. Andrea Reese. Kayla St. Pierre. Kayla Williams. I'd like to welcome back to the podium the Dean of Health Sciences, Dorothy Chase.
I'd like to have the EKG students stand and come over to the edge of the, okay, we're already here. All right. How did you get out of order? Jump over everybody to get to the front. I don't know how you got out of order. Yeah, everybody in that row is going to have to stand so they can get in front of you, please. Thank you. Our EKG certificate allows students to enter, practice, and perform many different cardiac tests and monitoring. The cardiac-related skills allow our graduates to perform EKGs, cardiac monitoring, and several other things that we have both within the outpatient department areas as well as our hospital settings. I'd like to welcome our EKG students to the stage. As I call your name, please come forward to have your pin. Stacy Avila. Amy Ballarino. Stephanie Fleurilus. Jemaray Garrett. Nellie Monestein. Kiara Porter. I'd like our dental hygiene students to now stand.
And I'll say the names.
Bristol's dental hygiene program produces dental hygienists. Our dental hygiene graduates are eligible to become licensed oral health professionals by taking a series of written and clinical examinations. Dental hygienists focus on preventing and treating oral diseases, both to protect teeth and gums and also to protect patients' total health. Most dental hygienists will perform oral health care assessments that include the review of patients' health history, dental charting, oral cancer screening, and evaluation of gum disease and health. Expose, process, and interpret dental radiographs, remove plaque and calculus or tartar from above and below the gum line using dental instruments, administer local anesthetics, educate patients on proper oral hygiene techniques to maintain healthy teeth and gums, and counsel patients on proper oral hygiene techniques to maintain healthy teeth and gums, and maintain optimal oral health, counseling patients on the importance of both good nutrition and oral health. In addition to treating patients directly, dental hygienists may also work as educators, researchers, and administrators. Thank you, family and friends, for coming to campus these past 2 years under COVID-19 restrictions and volunteering your time, support, and teeth for our students to practice on real patients. Our program chair, Professor Kim Broderick, will be reading the names. Dr. Manal Mawagar will be placing the pins on students, and Professor Williamson will be assisting.
Emily Gloria Abbott. Corinne Antunes. Savannah Cavallo. Is that better? Erica Coelho. Ashley Costa. Kyla Duffy. Ariana Goulart. Jocelyn Holland. Melanie Laura. Corey Madeira. Madison Maurice. Michaela Mello. Abby Nielsen. Marissa Raposa. Emily Saxon. Annie Tramontosi. Victoria Vaughn. Caitlin Vieira. And lastly, Samantha Weber.
I'd like to have all of our medical assisting students that are graduating please stand. And our second row can stand and please move down. Thank you. Medical assistants work alongside physicians, mainly in outpatient or ambulatory care facilities, such as medical offices and clinics. They are usually the first clinician you meet when you visit your doctor. They are most likely the ones that take your medical history, take your blood pressure, weigh you, review your medications, assist the physician with certain procedures, perform an EKG or an electrocardiogram, update your medical records, schedule appointments, assist with billing, collect laboratory specimens, and administer injections. Medical assistants learn a myriad of procedures and processes to ensure that your doctor's visit and follow-up visits go as smoothly and as beneficially as possible. If you are supporting a new medical assistant, thank you for volunteering as a test patient for a blood pressure check and other homework assignments. Our class of 2023 medical assisting students are here, and we'd like them to be pinned. I'm going to read each name. Melissa Cabasso. Jocelyn Donahue. Josabel Gomes. Amani Guerrero. Marissa Levitt. I'm now going to ask the first row of nursing students to please rise. This morning, we have Professor Jennifer Pimentel and Dr. Kathy Plant. They're obviously liked. We'll be pinning our nursing students, and Marie Kaczmarski will be reading the names. Everyone seems to know what nurses do and are, but do you? Nurses do much more than care for people in a hospital and can practice in so many places. Our graduates are prepared for entry-level practice, be that in a hospital or whatever setting that may be, medical surgical nursing, emergency room nursing, maternity, pediatrics, or psychiatric nursing. But there are so many other areas that our students go out and work in when they graduate. Community-based nursing, adult day health, assisted living, day habilitation, or long-term care. Our students were educated to be critical thinkers, use the nursing practice and the skills and information that they learned and absorbed through their education to become skilled, knowledgeable, and competent graduate nurses ready to become registered nurses. We are thankful for their hard work and perseverance through their program and have been impressed with their work and growth. Good luck with your NCLEX exam and your professional journeys wherever they may take you.
Kaylee Amaral. Selena Andrioli. Fatima Bacante. Hannah Blanchard. Joanne Borges. Kendra Botello. Randy Putin. Joseph Carrero. Kyra Sally. Serena China. Kylie Cordero. Bridget Cormier. Desiree Costa. Kirsten DaCosta. Yesenia DaCosta. Katarina De Almeida. Nina Diaz Macedo. Clarissa Douglas. Allison Foucher. Kylie Ferguson. Kayla Ferreira. Mackenzie Ferreira. Alexandra Fisher. Mafalda Franco. Caitlin Freeborn. Larissa Furtado. Meg Gale. Ben Ganda. Julie Giordano. Edward Godino III. Laura Hassey. Catherine Ignacio. Brianna Jardin. Philippa Jesus. Kaylee Krausick. Celine Lang. Richard Lombardi. Edward Lugo. Lindsay Martins. Chantel Mello. Fabian Merville. Amanda Morissette. Kimberly Nascimento. Alan Nasalo. Catherine Oliver. Kenya Ortez Moreno. Paige Pacheco. Ashley Paquette. Abigail Pellicier. Victoria Pina. Sydney Perez. Alexis Powell. Bethany Pratt. Janelle Presby. Krista Randall. Brianne Rodriguez. Samantha Rodriguez. Cecilia Rosado. Tanya Roy Balthazar. Tracy Shelford. Brianna Smith. Kendra Soares. Michelle Starkweather. Kevin Supo. Cassandra Sylvia. Lindsay Xavier. Thank you. I'd like to please welcome Dr. Chase back to the stage.
It's not going to be common. I'd like to have our occupational therapy students please stand. And I know you're in two different places. So if you could come around this way and around this way and come over to this side of the stage. And I'm going to ask Dr. DuPont Williams to come to the podium, and Dr. Connie Messier as well. You're going to speak and Connie's going to come?
Yes.
Good afternoon, everyone. Occupational therapy is a health and wellness profession that is not well understood. Occupations refers to everything that any human wants or needs to do. So it might include taking care of yourself, taking care of others, taking care of pets. It might include being able to drive, to think, to perceive, to learn. Occupational therapy works with individuals who are challenged emotionally, physically, or mentally, or cognitively, and we work with individuals who are facing these challenges to be able to learn and develop the skills to be able to do what they want and need to do. We work with people of all ages, from tiny babies in the NICU to early intervention and schools, hospitals, rehab clinics, mental health settings. We even work with individuals with horses with equine assisted therapy. It's a great career. There's a huge demand, especially with the burgeoning number of school children that have learning disabilities, and also the burgeoning number of baby boomers who are aging and want to stay home and learn how to manage doing what they need to do at home so that they can do that. I have something to say to our graduates. The faculty and I know how rigorous this program is and how it kind of throws you out of occupational balance while you're in school. We apologize for that, and we hope you put your life back together now that you're done. You are really superheroes in our eyes, as most of you have juggled the demands of college with jobs, caring for your children, paying the rent, what's that? And navigating a pandemic at the same time. We watched you help each other grow professionally over the past 2 years, and professionally, and personally, I should say. We watched you work together, help each other, become friends and colleagues. It's been a great process to watch. We know that you'll turn those bonds into the beginning of your professional network in your careers as occupational therapy assistants. So, audience, family, and friends, on behalf of the 3 Megans, Megan Birch, Megan Bossy, and Megan Dupuis, Kayla Cruz, Andrew, Kaya, Caitlin, Chantilly, Haley, Raphael, Lindsay, Amanda, Janel, Kelsey, Kristen, and Avery, we thank all the family and friends who are here tonight in person and those who are with us in spirit. We can't forget all those folks that influenced us along the way. And we thank the Bristol staff, the people from the library, the Office of Disability Services, registration, our staff assistants, our administrative assistants, Tina, Sarah, Dr. Chase, the president, our administration. You have no idea what it takes to support a student in these programs, and we get a lot of support. We're very grateful to everyone. These graduates could not have done this without your support, family and friends, without your support, faculty, without your support, administration and staff. Thank you so much. And families, we know that there have been tears and motivational talks and assistance and doing the laundry and washing the dishes, and you might get a break for a week or two until they start studying for their national board exams. Graduates, your faculty wish you well, and we thank you for being part of our community. As you go forward into your occupational therapy careers, never forget Bristol Community College and our high standards of collegiality, professionalism, ethics, and compassion that you've learned here. And don't forget to help future OTA students by agreeing to take a fieldwork student when we call you, and we will be calling you. Graduates, please come forward one at a time as Dr. Messier reads your names to be pinned.
This is an exciting time. Megan Birch. Megan Bossy. Andrew DeGrazia. Megan Grace Dupuis. Kaya Papaya Fennel. Kristen Hoff. Caitlin Landeville. Chantalie Leon. Haley Levesque. Our next graduate just happens to be the 500th graduate of the OTA program. Raphael Lopes. And Mocha. Let's save that enthusiasm for Lindsay Lucas. Amanda Marshall. Janel H. Patel. Kelsey Preble. And last but not least, Avery Ray Warner. Now, Dr. Chase.
If all of our phlebotomy students could please stand. Dr. Hiller? Professor Cinco? Okay. Jeff, you can come and read the names.
Yes.
So Elizabeth is first.
Okay, thank you. Okay, our phlebotomy graduates, a phlebotomy certificate. Elizabeth Corota. Junelli Castillo. Kristen Condon. Chelsea Estrella. Nitsi Helena Sevilla. Christina Hendricks. Comfort Corley. Sandra Leal. Samantha McWhinney. Elise Marie Quinones. Diane Raposo. She's not here. I saw her. I thought I saw Diane. Okay. Veronica Rodriguez. Gladys Rodriguez Hernandez. Tessia Simos. J. Millie Valentine. Sadesha Wright. I'd like to invite back the Dean of Health Sciences, Dorothy Chase.
At the end of this academic year, we have had two prominent faculty members that have chosen to retire, which is always sad for us as faculty and staff and administrators, and it's sad for students as well. But we're happy that these two people have chosen to retire, and we are wishing them well in their next steps in their life, in their retirement. But we'd like to take a moment to recognize them here for all of you as students as well, because we know that they have taken a lot for all of you. So we'd like to have both Dr. Kathy Plant and Dr. So I'll start by talking a little about Kathy, and then I'll ask the next person to come up. Kathy has been with Bristol as a faculty member for the past 14 years, and she is a proud graduate of the program. Dr. Plant has taken on many leadership roles while she's been here at Bristol, and I cannot say enough for how much she has helped me as I stepped into this leadership role as well. I started here less than 2 years ago, and I started first as an Associate Dean of Nursing, and now oversee both nursing and health sciences. And she has been just a wealth of knowledge for me in my role, and I know that throughout the time that she's been here, she's also been a wealth of knowledge for faculty, new faculty as they've stepped into positions. But I also know that she is beloved as a faculty member for all of the students as well, as they step in and through their journeys as students, and as they move through their journeys as new nurses as well. And we are going to miss her, but I will say that she has chosen to return as an adjunct faculty, and we are happy to say that she will return in the fall and the spring, teaching both lab and clinical. So we are going to pin Dr. Plant as well and give her some flowers. I'd also like to take a moment to recognize Dr. Johanna DuPont-Williams. And I am going to ask her colleague, Connie Messier, Dr. Connie Messier, to come and speak a little bit about Dr. Williams. Come on forward. Too many doctors.
29 years ago, today, I think, I stood upon this stage and received my pin as an occupational therapy assistant from this program, from the very first class. And I was fortunate and blessed to be pinned by Dr. DuPont-Williams. We understand what a pin represents, and it is at this school, at this level, that I learned my professionalism and my dedication to the profession. And today, I would like to pin Dr. DuPont-Williams, not with an OT pin, but a pin that represents all her accomplishments of the over 500 student lives she has touched and shaped and meant so much to. And this is ad lib. So Dr. DuPont is a beloved faculty, program director, and has served the needs of the community for many years. And I would like to thank her on behalf of the OT profession and the students. My friend, my mentor, my program director, Dr. DuPont-Williams.
I'd like to welcome Marie Kaczmarski for our closing remarks.
Thank you, and good morning, all. Is it still morning? It is, right? Yeah, okay. Sincerely, from the bottom of my heart, I cannot tell you how proud I am of each and every one of you who are sitting in front of us today. This journey you have been taken has not been easy, but you've demonstrated the strength and courage to make it through. As you enter in the workforce to begin or continue your careers in the nursing profession and health science professions, we want to honor your dedication and persistence to the community that you're serving. I would also like to take a moment to ask you to look around at the people that are here with you, that are your classmates, your family, your friends, the larger group that are here to support you and your impact to the community. We are your community. We are your larger Bristol family, Bristol community. And we are also the people that you will be helping and will be benefiting from your services and your education, your professionalism learned here at Bristol. We are excited of the new voices you will bring to help the healthcare system, the healthcare entity, and understand the diversity and inclusion that is required to help the overall system. The impact you would make is not only to our local communities, but for many of you, you'll know that you'll be making a global impact as well. Looking towards access for everyone, inclusive of our community as we strive to continue our service and dedication towards healthcare disparities. Your accomplishments recognized today are a tribute to your continued dedication, continued perseverance, as you have already heard from comments earlier today. I would like to I'd like to share with you a poem at this point. You have come so far, you have learned to let go of what was not right for you. You have learned to step out of the boundaries of your worries, believing that in time, it would all be woven together beautifully. It has not been an easy road, but it has opened your eyes to all of the possibilities that this life can be, even in your uncertainty. Please continue to give your all. In all things great and small, continue to see that even in your thankless, unnoticed work, you are still sowing seeds. You are still making mindful and intentional steps towards where you were meant to be. You are still living a life filled with meaning. There may be days where you feel like your work is in vain, and there may be moments you do not know what to do with all the sudden change, but you are wrapped in endless and boundless grace the same, giving you strength every day to breathe deep and keep going. And to our celebrants today, this is your moment. Think about that. This is your moment. You've been working towards this for years. Please give yourself a round of applause. As you start your journey, have the courage to fight for it. There will be times when you feel defeated or beaten. I promise you that. But I also promise that every single time it will be worth it. You have worked so hard to be here. Remember that by taking this journey, we thank you for taking this journey with us. We thank you for allowing us, your community, to recognize you and to share in your accomplishments. So to the class of 2023 in the health sciences and nursing programs, congratulations and thank you for letting us share with you. Stand up, you guys, let's see it, stand up. Yes, congratulations, you guys. This concludes our ceremony and recognition for today. Thank you so much for coming. I'd like to invite you for light refreshments out on the lawn under the tent. And thank you again. Congratulations.